Welcome back, everybody, to the interviews with veterinarians, doctors, scientists, pet professionals around the world, uh, talking about ways to improve our pets' health, their quality of life, and their hopefully length of life. I'm veterinarian Dr. Jeff Feynman. I'm here and I'm honored to be here today with a world-renowned naturopath and chiropractor and homeopath and doctor who optimizes everyone, human people's ability to heal, Dr. André Saine. So welcome, André. It's
Thank
a
you, Jeff.
pleasure to have you.
Thank you
So thank
for
you.
the
And I guess
invitation.
we'll just jump right in. Let's just jump right in by talking about how you think people can help their pets or themselves be healthier by focusing on their energy, their internal energy, and their vitality. And maybe we'll start with what you think vitality really is, how you conceive of vitality.
Well, if you want to talk about energy, there's two aspects of energy that must be considered. One is the quantity of energy, and the other one is the quality of the energy. So if you talk about the quantity of energy, when you're born, that's when you have your full battery. And when you're very old, your battery is low, so your energy is less. So there's a quantitative aspect of it. But people should different stress of life, different difficulty of life can lower this energy, can have a lower energy because of stress and malfunctioning of the organism. So this brings us to the second aspect of energy is the quality of the energy. So the quality of the energy can be harmonious. So when the energy is in a state of harmony, we don't feel anything. We don't feel tired. We don't have nausea. We don't have dizziness. We don't have pain. We don't have fear or anxiety. We don't feel anything. We don't feel our heart. We don't feel our digestion. We just feel quiet and peaceful. So that's a good quality of energy. Now, through the stress of life, the difficulty of life, and problem, different force of life can damage our system. Let's say physical force being hit by an object will disrupt our system, and it will disrupt the energy, and we will have symptom, sign and symptom, discomfort, and so on. So one of the thing that the practitioner of health or even anybody can do is live a life that is conducive to good health. And a life that is conducive to good health means to avoid the cause of disease and do what and fulfill the requirement of the living organism, the psychological requirement, the environmental requirement, the nutritional requirement, the rest and the hygiene requirement, like rest and sleep requirement. So if you fulfill what the living organism, each living organism needs, you'll better maintain health and promote longevity, a good, long, healthy, functional life. However, with the life is not always easy. Some people say it's a messy business. And so, yes, there will be difficulty in life that we don't choose. We don't choose the family we're born, and we didn't choose the environment or the country. But so we will face difficulty, all kind of difficulty in our life. It could be accident, it could be infection, it could be just major stress that will overwhelm our capacity to adapt. So we will become sick, and if we do become sick, then there should be a really well rational approach to sickness. The first thing is any approach should not damage further the organism. so primum non nocere. So any approach for diagnostic or therapeutic purpose should not. Second is there are reasons why people are sick. They're caused to disease. So the first, the job of the physician is to identify the cause of sickness, all the cause, the internal susceptibility and the external factor that makes somebody sick, and try to modify these causes in order that the organism can return to health. And one of the fundamental concepts of alternative healthcare is vis medicatrix naturae, meaning that there's a power inside the organism, the living power of life, what makes life. It's an energy, it's a force, and that force will always try to go back to a state of balance. And the role of the physician is to encourage this force to go back to the state of balance, harmony, where you have no symptom. So, and that's the goal of life. The goal of life is to be, it's a harmonious whole. And so the physician can use forces outside of the organism or force within the organism to help the organism to return to a state of balance, harmony. And so the concept of force of vital force is crucial, is a cornerstone of many traditional systems of medicine and of naturopathic medicine and homeopathy. It's a cornerstone. If you remove the vital force out of this equation, you remove the vis medicatrix naturae, the capacity of the body to heal itself, and then you come down to the physical, chemical approach of conventional medicine, which is a mechanistic approach of molecular, and you try to block a molecule or you try to encourage a molecule, and there's no concept of the whole. So the concept of vital energy provide a concept of the whole, of harmony and self-healing.
I gotta stop you there because you just introduced about 20 different really important concepts we're not gonna be able to go over, but I want to start at the end that you're equating vital force with vital energy, with vitality, with that battery that you mentioned at the beginning that's full when you're young and may wind down when you get older. And I guess I like to say that it's two ends of the spectrum. You either have vitality and you're alive, or you don't have vitality and you're not alive. And that's a concept that's important, is it's preserving that, that energy, that vital energy, vital force that you mentioned. The other concept I wanted to bring in, because it's so relevant to our pets, is the connection between the quality of energy, the balance of the energy, and symptoms. So I believe you said symptoms of ease, you don't really even know they're happening. So you're at ease, you're happy, you're able to go into every situation. If you're a pet, you can eat a different food at every meal. You're not restricted by life. And then you get into dis-ease. So what are some factors that can avoid pets or people from getting into dis-ease? Simple things that people can start today, like, eating processed food. Is that okay? Feeding, where you feed our pets, dry food out of a bag or out of a can, or total cereal or McDonald's for people. Is that going to maintain the energy and a good qualitative balance?
Well, the science of health, hygiene is the science of health. There's multiple aspect to it. Nutrition you were mentioning. So yes, we know a lot about how to maintain the living organism healthy by providing its needs, its fundamental needs. We need light, we need heat, we need water, we need rest, we need nutrients. So we need love, we need to have an environment that is peaceful. So there's fundamental needs, and we don't always get these fundamental needs. good nutrition is not, parents are not taught what is good nutrition. And uh, pet food companies that make food for pets don't necessarily make the food for health. They make it for the buck, what is convenient for them. So you have to educate yourself. That's the key. To remain healthy is you have to educate yourself and know how to maintain yourself. And it's also individual to the person. One person may do very, very well with vigorous physical activity, and that's very good for that person. But another one will be much better just with mild activity like yoga, with stretching and so on, not so much cardiovascular. So every person is different, and every person has to figure out what are their needs, their fundamental needs. But there are general rules, like you're mentioning, like processed food and so on. Yes, study shows that the more you feed an organism with nutrition that is fundamental for that organism, you will promote health. If you feed this organism with food that is not well, could actually poison the organism, or endanger the organism, or damage the organism, then you will promote degeneration of this organism, and degeneration will mean poor health and symptom and early death.
By organism, you mean any living being, anything with a vital force, anything alive, a person, a pet, any other animal.
Yeah, everything that is a living organism, because the rules applies to plant, they apply to microorganism, they apply to every animals, and human is an animal, so it applies all across the spectrum of life. If you fulfill the living organism needs, the organism will live very well. It will have a good life. But as soon as you disrupt the needs, you'll create imbalance, and this imbalance will show up in disturbance of the organism itself, and eventually early death. You change the environment. If you change the environment, it's a very well-known phenomenon. You change the environment, you will affect the living organism. If you destroy the environment of which the environment depends on, you destroy the environment, the organism.
Yep. And I want to respect your time today, and I again really appreciate your sharing with us today. But I just wanted to quickly bring in what you said about the balance, about the quality of energy, and another important concept that you introduced, and that is individuality, that we're all individuals, that it really depends on who we are, what we should eat, what's good for us, what exercise is good for us. But let's assume that we've done that we're living in a good state of ease, but maybe there's some internal imbalance. And then we're exposed to a germ or something else that's a stressor to the, that balance. We'll take germs as an example. What do you think is more important, that balance or the germ?
Well, it depends which germs and how it's introduced in the body. If we take a syringe full of spirochete of syphilis and I inject intravenous in somebody, they will have a big infection.
Let's assume that's not going to happen.
Okay, but you can see
two dogs go into a kennel. They're both exposed to the bacteria virus of kennel cough. One gets kennel cough and one doesn't.
Yeah, but aside from the extreme situation that I mentioned, artificial situation, the more the better fed is the organism, the better health is the organism, the less susceptible they'll be to microorganism. But we live in symbiosis with microorganism. We have all the microorganism in our digestive tract, so they're very important. And it's important to develop the symbiosis through life. So as a child, you will develop some mild infection like low coryza and so on. And that's fine, because that's how the immune system must develop. So those interaction with microorganism helps the immune system to develop, and they're necessary. But there's a point of where the increased susceptibility where you get you develop infection very easily, and that will be a problem of poor health, because it could actually endanger somebody's health. So yes, so the better health you are, the less susceptible you will be to develop serious infection. You may develop mild infection, but your body is able to overcome it easily as a rule. If not, then sometimes a little push from a little intervention can make a quick difference. However, people that live live a good lifestyle, they will tell you they very rarely have any infection whatsoever, and they have a very active lifestyle. They travel like other people in airplanes and so on, but they never get an infection. Some people will say, before I changed my lifestyle, I used to get the flu 2 or 3 times a year. I used to get bronchitis every winter. Then I changed my lifestyle. I started to do yoga. I started to eat better. It changed the organism. The epigenetics changed. The immune system changed. And they say, in the last 10 years, no infection, no more, because the internal environment has changed.
Fantastic. That sums up everything. That's great. Thank you. Thank you. Thank you. We will hopefully do this again soon. And thank you all for watching. And thank you, Dr. Saine, for being with us. And have a great day.
Thank you, Jeff, for an invitation, and have a good day too.
Okay.